Many of us have problems with urinary incontinence. It manifests when we sneeze or cough or laugh or jump, and it causes us to not be able to do the things that we enjoy doing, or to have to stop doing them in order to get ready and change and pad and all of that sort of thing. It's super common. If you've had a child or two, the probability that you having pelvic floor laxity that manifests by urinary incontinence or sexual dysfunction is very, very high. Half of women who have had kids have this problem. And it's so great that there now is a very easy device called Emsella, where you sit, you relax, and you enjoy the strengthening of the pelvic floor muscles by this device causing the equivalent of 11,000 Kegel contractions in a mere 28 minutes, very comfortably. And so not only do people see a dramatic improvement in the ability to do whatever they want without having to worry about urinary incontinence and leaking, but many people find a nice improvement in their experience in intimacy, because their pelvic floor is now strengthened and tightened and supported. So the great thing about Emsella is it's a chair platform that you sit on, and it finds the center to give you the contractions that is part of the treatment. There's no radiation, there's no thermal energy that's going in there. This might cause some burning or discomfort or recovery. Fully clothed, you can walk in, walk out, have a lunchtime treatment. There's no recovery. You may feel a little exhausted down there for half an hour or a few hours, but really just like you've had a really intense workout. It takes about 6 treatments. We sell a package of 6 for $1,500, and we actually will include a couple more in there as maintenance. Maintenance could be done every 6 months, every 3 months, every month. There's only about 30% of people who think they know how to do a Kegel exercise who's actually doing it correctly. And how many of us, even if we set a goal of doing Kegel exercises, actually follow through and do even 300 of them? This is going to do 11,000 Kegel exercise contractions in 28 minutes. So what are the alternatives to doing Emsella? Well, you could continue to wear pads, and that gets expensive if you're wearing pads every day or changing them several times a day. And plus it's uncomfortable and might not even look the best through your garments. 2, you could talk to a surgeon about having some kind of a pelvic floor sling or a urethral sling procedure, which really honestly doesn't work very well, and there's some recovery and expense and risk to doing that sort of thing. It could cause the problem to be worse. You could see a pelvic floor therapist and do that sort of thing, which also can be extremely uncomfortable and very expensive and kind of invasive, and also has very limited results compared to this device, which has much better results.
Woo! It's such a weird thing to describe. It doesn't hurt at all. It's just like tingling. Mm-hmm. You can definitely feel it contracting. Mm-hmm. It feels like it's doing a Kegel for me, which is weird.
Exactly.
And I think like most people can't do Kegels.
Mm-hmm. Right. Only 30% of people can actually do a Kegel.
But the way to figure out if you can do a Kegel is if you can stop your pee midstream.
Right. Mm-hmm. That's what they say.
So you guys should try that at home and see if you can actually do a real Kegel. It's really, really manageable. No pain. It's kind of like a butt massage, to be honest. Okay, so now it's doing tapping motions, which is to break up the lactic acid. I just completed my first session of Emsella. I had no pain whatsoever. It was completely comfortable to the point where I even had my lunch. I was eating my lunch while I was sitting here. That's how comfortable it was.